Wellness for Life is brought to you by Perham Physical Therapy, Gothenburg Chiropractic Clinic, and Mojave Ottawa Community Action Partnership.
Hi, I'm Dr. Gothenburg, a chiropractor here in Pelican Rapids, and I think today what I wanted to talk a little bit about was it seems now in our practice that MRIs or CT scans have become almost commonplace, replacing a lot of times what we were most familiar with, just the standard X-ray. And I think the other thing is when I review these with patients, they're always surprised at the fact when I say, well, the MRI reveals arthritis. So I think people are very surprised usually when they hear that word, although it's a very common word. So today I want to talk a little bit about some of the terms that you might hear on an MRI report, and then I'll talk a little bit about the progression of arthritis. So what I have here is an MRI report that uses words like bulging disc or narrowing, foraminal narrowing, spondylosis, or facet changes. And first of all, I want to tell you really not to worry about a lot of this. I think the word that I get concerned about the most is when I read the word stenosis, which means a narrowing. If it involves the spinal cord, it's called canal stenosis. If it involves the small canal where the nerve exits the spine, it's called foraminal stenosis. I worry about that because now I'm dealing with a space issue. There's something that is compromising that given space. The other words like degenerative disc, what I can tell you about that, or the word facet, which means joint. So think of when you see someone with a degenerative change of the knuckle, and it changes the shape of the knuckle. And so the MRI images this. Something has changed. It's visible to the radiologist. And the significance is that at about age 60, 7 out of 10 people when x-rayed will have a degenerative change. By the age 70, 9 out of 10 people. So it's almost inevitable that as a chiropractor, we're going to be working with people with various forms of degenerative arthritis. So where we're at now is really how does this progress and when is the right time to intervene? And so at the beginning, using this as an example, if one has a loss of what I call a normal curve, the spine has normal curvatures. When that happens, usually it affects alignment. And alignment may show up in two ways. It may show up where motion is limited, restricted, or exaggerated. And over time, what we develop is weakness in either the ligaments or the muscles. So this is where the problem starts, and this would be the best time to intervene. Because when you don't address the problem, for example, maybe using medication to address the problem, over time, it may take years, now the joint takes on somewhat different appearances, where we start to see a thinning or a loss of joint space, or in this case, the body attempts to stabilize the joint by causing bone spurs. If you let it go farther and really neglect it, then the joint takes on some really drastic changes. When the disc begins to collapse and the body begins to calcify, these changes are, for the most part, irreversible. So what can we do for those people? We are comfortable working with, and we still work with people with arthritis. So that is not something that we can't handle. But our results are going to be different. So where in the very early stages we want to correct a problem, now our results change where our purpose is to provide relief, or it may be to improve range of motion, to allow you to feel better, and more importantly, to do things to stop or slow the progression. So we have to take it on a case-by-case basis. Where is each person at on this progression, and what kind of benefits can they receive? Some people need regular care, and they don't get it, but they need regular care. Some people choose physical therapy, and yet there's little discussion involving alignment or working with one structure. So I work with physical therapists that are providing some care as far as muscle strengthening, conditioning, and we're working with alignment. To simply do nothing, you're just hoping to get better. If you do simply nothing but take medication, a year from now, 6 months from now, your condition would be worse. So it's a big subject, but chiropractors are well qualified, and we're able to help people anywhere along that progression. If you have questions, please give us a call here in Pelican or in Monaga. Thank you.
Thank you for watching Wellness for Life. Brought to you by Purim Physical Therapy, Gothenburg Chiropractic Clinic, and Mojave Ottawa Community Action Partnership.